This is the active knee extension test, which measures flexibility and length of the distal hamstrings. The movement involves active knee extension at the tibiofemoral joint and the sagittal plane. This test is important because limited knee extension is caused by tightness or reduced length of the distal hamstrings. When the hamstrings can't fully lengthen, they restrict terminal knee extension and can alter lower limb mechanics during gait, sprinting, or cutting. In sprinting athletes, this limitation increases the risk for hamstring strains and places additional stress on the knee joint, especially when the leg is extended quickly. Since this is a quantitative exam, I'll perform 2 trials on each leg, and the joint angles will be measured later during the video editing process. If the knee cannot reach 180 degrees of extension while the hip is flexed, that will be considered a fail. If the knee can reach 180 degrees of extension while the hip is flexed, that will be considered a pass. The test will begin with the knee flexed and is then actively extended until the first point of resistance without allowing the thigh to move. For measurement landmarks, the goniometer's fulcrum will be placed over the lateral femoral epicondyle. The stationary arm will align with the greater trochanter, and the moving arm will follow the lateral border of the lateral malleolus. Now for the setup. The hip will be flexed to 90 degrees and the opposite leg will remain flat as I'm stabilizing the thigh to prevent movement. So you can flex this knee to 90 degrees. I'll support you here. Keep the ankle dorsiflex, so point it up in the air. Extend the knee slowly, and once you feel the first resistance point, you can stop. And come back down. Perfect. Other potential errors that will indicate a fail in this exam include inability to maintain a hip flexion angle of 90 degrees when extending your knee. Another possible error can be seen with moving the contralateral leg when attempting to extend the knee and hold the hip flexed at 90 degrees. As you can see, 180 degrees of knee extension is not achieved during this test, which indicates that the distal hamstrings are unable to fully lengthen across the tibial femoral joint. When the hamstrings are excessively tight, they exert a posterior pull on the pelvis, tilting it posteriorly and flattening the lumbar curve. The pelvic position reduces the efficiency of hip extension and limits overall lower body mobility and functionality, restricting stride length and potentially altering gait and squat patterns.